Hello, I'm Dr. Shery. I'm an obstetrician and gynecologist. So I will be telling you about the common first trimester do's and don'ts and the precautions that you should be taking in pregnancy. So first trimester means the first 12 to 13 weeks of pregnancy. So as such, pregnancy is very strong and very robust. So nothing can shake a pregnancy that easily. ஸோ ரொம்ப காமனாக எல்லாருக்கும் வர டவுட்ஸ் என்னென்னா ப்ரெக்னன்சியில் என்ன பண்ணணும் என்ன பண்ணக்கூடாது எப்படி இருக்கணும். இட்ஸ் வெரி சிம்பிள். யூ கேன் பி வாட் யூ ஆர், யூ கேன் டூ வாட் எவர் யூ வாண்ட். ஆல் தட் யூ நீட் டு டூ இஸ் அந்த 2 லைன் ப்ரெக்னன்சி கார்டில் பார்த்த உடனே ஜஸ்ட் கோ அண்ட் மீட் யுவர் obstetrician. She or he will just guide you on how to go about. So you just have to do either a dating scan as soon as you meet your doctor, so that the doctor will find out if the pregnancy is formed inside the uterus, how many children are there, and is the heartbeat come or not. So it's very important to rule out an ectopic pregnancy. Ectopic pregnancy na pregnancy tube la nikkiradhu. So adu irka illiyantinu we get an idea about it. The next thing is she will prescribe you a lot of investigations. Now these investigations are mainly to know how your pregnancy is there. Are you having any BP, sugar, thyroid or any issues related which can affect your pregnancy. And the other thing is you would be prescribed folic acid tablet, that is 5 milligram. Folic acid is very essential because it prevents neural tube defects. Folic acid is also a part of the B complex group of vitamins. Now the next thing is your diet. You can eat everything that makes you feel comfortable. இப்போ diet வந்து பாத்தீங்கன்னா அட்லீஸ்ட் ஃப்ரூட்ஸ் இருக்கணும், நாட் அட்லீஸ்ட் கண்டிப்பா ஃப்ரூட்ஸ் இருக்கணும் டயட்ல, கண்டிப்பா வெஜிடபிள்ஸ் இருக்கணும். யூ ஷுட் ஹாவ் அ லாட் ஆஃப் நட்ஸ் ஆல்சோ. ஸோ தீஸ் ஆர் தி எசென்ஷியல் வைட்டமின்ஸ். நீங்க வந்து நிறைய சாப்பிட வேண்டாம். யூ நீட் நாட் ஈட் அ பிளேட் ஃபுல் ஆஃப் ரைஸ் அண்ட் ஆல். தட் இஸ் நாட் கோயிங் டு கிவ் யூ ஆல் த ஹெல்த். யூ நீட் டு ஹாவ் லாட் ஆஃப் ஃப்ரூட்ஸ் அண்ட் வெஜிடபிள்ஸ். That is where your nutrients and your multivitamins come from. Apart from that, you need to also have a lot of fluid intake. Now fluid need not be a lot of juices. Fruits சாப்பிடுறதா நல்லது ஜூஸா குடிக்கிறதை விட. Because when you have a juice, you lose the fiber in it. So please have a lot of water along with a good source of fruits and vitamins. You can obviously do your normal walking, stretching, your pilates. All those things are definitely a must to do in your pregnancy. Now, it is not mandatory to take bed rest in pregnancy. It is not mandatory to take progesterone tablets in pregnancy. Please do not take any other tablets which are not prescribed by your doctor, as in tablets for acne or any other things like headache or cold, fever. Please take tablets only after discussing with your obstetrician. And please change your lifestyle if you feel your lifestyle is not suiting your pregnancy or not going in the healthy way. You can obviously eat food from restaurants. Just make sure your food is not having Ajinomoto in it. It is better to avoid raw, uncooked animal protein, that is raw meat. It is better to avoid that because it can give rise to a lot of infections like salmonella and listeria. So that is better to be avoided. Apart from that, many people have doubts about having pets at home. Having pets is definitely a pleasure. But just one point to remember is that if you have cats at home, please do not clean the cat's litter with your hands. Instead, just use a glove to clean the litter because it can commonly give rise to an infection called toxoplasmosis. And regarding diet, some other points about diet is that alcohol, smoking and other recreational drugs. It is better to avoid all these because alcohol, even in minor quantities if taken in pregnancy, can cause mental, behavioral and physical problems to the baby. Smoking and other recreational drugs is also a strict no in pregnancy. Other small symptoms in pregnancy like skin changes in the skin, like having acne, darkening of skin, darkening over the belly, protrusion of the belly button, all these are very common in pregnancy. You need not get worried about it. Easy tiredness, fatigability, gastritis, flatulence, all these are again common in pregnancy. Some people also have lower abdomen pain and some people also have soreness in the breast. It's absolutely fine to have all these things because there's a lot of progesterone hormone rising in your body and there's a lot of activity going inside. So it's absolutely fine. Now what you need to be alarmed in your first trimester is when you have excessive lower abdomen pain or when you have some amount of bleeding, either little or more, please consult your doctor immediately. So first trimester is a very nice experience. It's a very nice phase of life. You just need to enjoy every bit of it. And in case you have any doubts, please meet your doctor immediately.